and this is our MRC point of dispensing training. So after this, if you aren't already able to, the goal is to be able to define pod, a bunch of acronyms, SNS, RDS, MCM, and then understand what, why, how, where, and when we would set up pods and what your role might be in helping out with that. The Southwest Utah Public Health Department, we cover 5 counties, right? It's a large geographical area. We have 5 offices, one in each of the 5 counties, and we have about 75 employees. And that may sound like a lot, but when we're considering that there are close to 300,000 people in our district and that not all of our staff are nurses, we only have a very small number of nurses that work here, we're going to need a lot of help. We also have millions of visitors that come into our area annually, and part of the pod process accounts for all these people. So the pod is really designed to quickly get medications out to the entire population. And that's going to take a lot of people. We're going to get into that. The MRC is a critical component of that. During COVID, there were times when we didn't have any employees of the health department sitting at the tables giving out vaccinations. It was all MRC and other volunteers that came in from EMS agencies and things like that. So we heavily relied on a lot of you during COVID, and we want to maintain that capacity, maintain that capability, so that in the future, if hopefully we don't have to, but if we ever have to do this again, we're ready to do it. So part of that is going to be your personal preparedness. So make sure that you're completing all of your online orientation, initial trainings. Keep your information in Utah Responds up to date so that if we do put out a notice that you get the alerts, participate in the pod trainings like what we're doing today. Each of you have a MRC bag. Make sure that that's up to date, and then add anything that you think you might need to it so that you're ready to go. And then ensure that you have your personal and family preparedness. This goes for our employees, anybody that really comes and helps us out. We want to encourage them that they're able to respond. So all of our staff go through training. They all have a similar bag to what you get that's for their personal preparedness so that they're able to respond. All right, so there's different types of events that might require the activation of a pod. So we can have a pandemic like COVID, an epidemic, something that may be more local. We can also have natural disasters, and the worst, of course, could be some sort of biological attack where some kind of weapon of mass destruction in the form of a biological threat is released. So that could look at anything from anthrax. That's where this really all initiated, was from the anthrax attacks that happened back in Washington, D.C. and throughout the country. But there's other what they call category A agents or diseases of concern. So we have pandemic influenza, we have pneumonic plague, botulism, something novel like COVID, something new that we've never seen before, hepatitis. There's other diseases that could result in us needing to activate a pod. So it's not just a disease, it's also a public health emergency declaration that'll be required to activate this. So what is a pod? A point of dispensing. So this is where we are going to take medications, prophylactic medications that are designed to prevent disease. We don't take anybody that's sick. If they're sick, they need to go to the hospital or talk to their primary care provider. The idea is to prevent people from becoming ill. So the pod is a point of dispensing. Medical countermeasures is the actual medication that we're distributing. So it's antibiotics, maybe vaccines, maybe it's antivirals. There's other things that they could be classified as medical countermeasures. And again, it's to prevent people from becoming sick. So prophylaxis is that treatment to prevent disease. So an example of that would be doxycycline administered out to the general public if we had a pneumonic plague outbreak. What a pod is not, it is not a treatment site. So if somebody's already ill, again, they don't come in. So the greeter and the screener, the very first person that they meet at the door, hey, how are you? How are you feeling today? Are you having any of these symptoms? No, okay. If you are, you need to go talk to your doctor. It's not a testing site, although there may be some similarities between pods and testing sites. It's not designed specifically to talk about testing sites. It's not an alternate care site. So if the hospital overflows, a pod is not where they come to receive treatment. And it's not a shelter. People don't come and stay here overnight. The idea is to get people in and out as quickly as possible and get the medication that they need. So what is the Strategic National Stockpile? So this is the store of all the medical countermeasures the federal government maintains. Throughout the country, there's these big warehouses. Sometimes they even have agreements with vendors that they hold this material in certain places. And it's designed to replenish state and local health departments, healthcare facilities, first responders, and other organizations. So during COVID, they distributed a lot of PPE. A lot of that came out of the Strategic National Stockpile. And since COVID, They've changed up what they have in the strategic national stockpile and added more PPE because that was one of the big aspects of the COVID response, right? So gloves, gowns, masks, things like that. So we have antibiotics, antivirals, vaccines, immunoglobulins, chemical antidotes. Some of these, the only place in the country where you can find some of these things may be in the strategic national stockpile. Antitoxins, life support medications, IV stuff, airway, medical surge items, and like we talked about, PPE. It's a lot of different things. I went to a presentation and I'm trying to remember how many billions of dollars they said it was that they worth of inventory that they maintain. It was astronomical how much material that they have in this stockpile. So it's scattered throughout the country. And the idea being that if there was a request, this medication would be able to be delivered to anywhere in the country within 12 hours. So here in the first picture you see, it's the warehouse. They then take it, they load it up on airplanes, fly it to whatever closest airport there is, and then it's trucked out to the individual locations. Once it's shipped from the strategic national stockpile, it goes to a regional distribution site. So that's where we, as the local health department, receive it. So this is where we're going to set up our warehousing operations. This may be something that you may be involved with. This is where we receive the chunk, right? This is going to be pallets. In this case, it was PPE, came to us, and then we then break it out and distribute it to individual pod locations. So we get the pallets from the feds or from the state, and then we break it out and then give it to Beaver County or Garfield Memorial Hospital or a certain church group or whatever it may be. Long-term care facility, yep. And it could be any of that stuff. So we have different types of pods. We have what's called a super pod. This is usually one location operated by the health department. So think COVID. So we had one location in each of the 5 counties that was run by the health department. We brought in additional staff. We brought in MRC. We hired people temporarily. We had the National Guard. They came in and helped us, and we set up these super pods. An open pod is open to the public that's run by a host organization. So SUU is one of our open pod locations. So they would set up and run a pod. We do training with them. We'd send a few staff to go help support. So maybe a clerk, maybe a nurse, but it's primarily going to be run by them. And then we have closed pods, which are individual organizations, not open to the general public. It's the 12th ward or whatever. We give them the medication. They don't get any additional staff. We give them the paperwork, and they then distribute the medication within their own organization and then return any unused medication and the paperwork back to us. So that's kind of the 3 different types. And depending on the scenario, depending on how much of the medical countermeasures are available, will determine which one of these models that we use. During COVID, there wasn't really enough vaccine initially to go past doing the super pod. We only had a few thousand doses initially. We were able to handle it within house. And so this is kind of an escalation, right? So we'll start here, and then we'll move down into each one of these additional steps as needed, depending on the scenario, how quickly we need to get the medication out, and what our staff capacity is. During COVID, it was a vaccine, which had to be kept cold. We had to have cold chain of custody to make sure maintain that documentation. And so we weren't able to go to closed pods or even open pods. It was mostly just the super pods. So here's a couple pictures of our annual exercise that we do, the flu shootouts. So that's our pod exercise that we conduct every year. And this really helps us out. It helps maintain our staff training and familiarity with the process. It helps with our logistics, and it helps get the MRC involved. We invite community partners to come out and participate in our exercises so that they can see what the process looks like. Now, each location is going to be a little bit different. Here we're doing a drive-through. Other cases we might be doing a walk-through. It all depends, but the process is going to be very similar. So here's a summary for you, kind of a timeline to help kind of break down what this might look like. So we have a disease outbreak. It's detected through our epidemiology. It's something of concern. Public health emergency is declared either at the local, state, or federal level. We identify the treatments. We're going to say in this case, antibiotic. They are either going to develop new antibiotics or develop new vaccines, depending on the threat, or if we have ones that are already existing. So like during COVID, we didn't have the vaccine right away, right? It was something new. They had to develop it. So then the state and health department, the governor, could request the deployment of the strategic national stockpile. It has to go through the state. We don't request it ourselves. We can make a request to the state, and then the state makes the request to the feds. Okay, then we're going to activate our strategic national stockpile medical countermeasure plan. We're going to identify our pod locations. We're going to send out notifications to those locations and say, hey, we would like to set up a pod at your location. We have agreements in place with many different organizations and locations to use their facilities. We're then going to activate our MRC. We're going to send you an alert and say, hey, we've got this thing going on. Are you available? The medical countermeasures are going to then arrive within 12 hours of our request at the regional distribution site. And then we're going to inventory and then divide out that medical countermeasures for each pod. So then we are then either going to deliver or have the pods pick up the medical countermeasures. We'll do some kind of just-in-time training depending on the threat and depending on the medical countermeasures. Different threats, different diseases require different types of medication, different dosages depending on if it's an adult or child. So that's where that training will go into place so everybody's on the same page and everybody understands what they need to do. Then we're going to set up the pods. We're going to send out communication to the public regarding the medical countermeasures, where to get it. And then this is really important. All the pods need to open at the same time. You don't want one opening in Washington County and one in Beaver County at different times, because just like what we saw during COVID, people will travel, especially if this is widespread, thinking a national or even a global event. And if they think, oh, well, I can go down from Salt Lake to Beaver County to get an appointment or to get in. We saw that during COVID, right? So we want to open them all at the same time so people will go to the nearest pod to them. We don't want them to travel from other parts of the state, because they'll be doing the same thing in other jurisdictions. Other health departments are going to be running the same program. So then we're going to operate our pods. We'll run multiple shifts if we need to until either the supply runs out or the demand runs out. So we're going to go. We might be running 12-hour shifts. Might have 2 shifts a day. Might have 3 shifts a day, depending on what the need is. Some of the scenarios, like anthrax, they want us to be able to distribute medical countermeasures to our entire population, all the visitors that are here, within 48 hours. So that's why we need lots of agreements, lots of organizations to help out with this, to get this out very quickly. So then once that's wrapped up, we'll demobilize our points of dispensing, and then we will do a hot wash. We'll write up after action reports and say, okay, how do we do better next time? So no matter if it's a drive-through, if it's a walk-through, these are really the core steps that need to happen for every single person that comes in the door. So they need to go to the greet/triage person. This is the very first person that says, hello, how are you? How are you feeling today? Hand them their paperwork so that they can start filling it out. If they're sick, then we divert them off to go to their healthcare provider. Then they need to go to education. This is going to be where they're receiving information about the medication that they are going to receive. In this scenario, it's most likely going to be something that they are going to take home with them. During COVID, it was a vaccine that we gave them right there. If we're opening up open pods in other scenarios, maybe it's antibiotics that they're going to then take home and take for possibly weeks. So we want to make sure we educate them about the disease threat and about the treatment that they're about to receive. Then they go to screening. So they've got their paperwork completed. We're going to have someone go through the paperwork and make sure that they've answered all the questions depending on the medication, their age. We may need to send them to get different medications, right? So just like COVID, we had different versions of the vaccine for different age groups. There were just different brands. Depending on the individual, they would go get one or the other. So then they go to the medication dispensing, and then if there's an observation time like COVID, they had to wait for 15 minutes, or they then go out. So those 5 steps, the pod layout is really important, and each location is going to be a little bit different. And I can tell you, this was probably one of the biggest things that we had to work through during COVID, was figuring out how to set up our pod location. And we had to start from scratch. A lot of the locations that we had set up or designated before COVID were not available to us during COVID, because it was such a long process. It was months, right? It wasn't quick. It wasn't just 2 days or 3 days. It was a long process. So we had to find locations that we could set up and leave our stuff set up, because the logistics of setting up and taking down quite a bit of effort. So designing it, figuring out the flow is really important. Here's an example of possible pod layout. This is a gymnasium. So first you have your greeter here. They're going to come in the front door. And the idea with pods is you really want a one-way flow. You don't want people going counterflow. You want one entrance, one exit, and the process to go through to make sure that they hit each one of those 5 steps. They first start here. They're entering. They're greeted. Then they go to education over here. It looks like they've got a TV or something set up where they're playing a film, or possibly somebody's there giving instructions. They're also there filling out their paperwork. Then they go to screening, checking their paperwork, make sure that they've got all their documentation correctly. And then they go to the dispensing, they get the medications, and then they go out. Over here, we've got that area for special needs. Maybe they're mobility limited, so they've got a wheelchair, something else, may need some additional help. And then we've got our command area / break area. So taking care of you, the volunteers, the workers is really important. So just like at the senior center, we had a separate area that was set up for people to get breaks, drinks of water, lunch, that kind of stuff. We want to make sure that we take care of our staff that are working in the clinic so that they don't get burned out. Translators come in and help us at some of the pods. We worked with the deaf and hard of hearing community to specifically set up a time where we had translators available. We do have some people that speak Spanish and other languages within the health department, and we have our language strike team, which is through the Medical Reserve Corps. How do we organize ourselves? Because this is important, right? We're pulling people in from different organizations. There's health department employees, there's Medical Reserve Corps. We may be bringing in National Guard. We may be bringing in EMS, law enforcement, emergency management to help out with this process. So this is kind of how it's set up. For the pod, we have a pod manager. That's the person on site that's in charge of that pod location. Now, they may be reporting up to maybe the health department. They may be reporting to the health officer. And under them, they have 4 positions. We have our clerical supervisor. This is the person that's over anybody that's non-medical. So these are our greeters, our screeners, they're our runners, education, observation. So that person kind of oversees all the non-clinical people that are working within the clinic itself. Okay, then we have our safety person. Their job is really straightforward. We want to make sure that people get in and get out safely. So tripping hazards, traffic issues, signage, all those kinds of things are important. Also with the mobility assistance, wheelchairs, if needed, first aid station, things like that. We have our logistics section. These are the ones that are the getters. If we need more tables, we need more chairs, we need more signs, we need waters, we need food, we need whatever it is for the staff to make sure. We need somebody to make sure that each table is stocked with enough medications. People run out of medications at one location. The logistics people are the ones that then get it to them. Okay, and then we have our clinical supervisor. This is the person that's really focused on the medical aspect of it. This is the person that's over the dispensers, making sure that the correct medication is being dispensed. Maybe they're managing the vaccine, or if there's cold storage issues or things like that, or if there's questions. This is the clinical person. This is usually going to be a pharmacist, a doctor, a nurse, somebody that has a medical licensure to make sure that we are giving the correct medication to the right person at the right dose. And they may have an assistant, and they may have multiple people working under them. During COVID, at some points, we had 20, 25 nurses working at one time. And so you had to have one person that kind of helped make sure everybody was on track. And these are what we call job action sheets. So the nice thing that Nathan's done actually has gone through and updated these. So if you show up at a pod, we have these job action sheets that we can hand you and say, okay, you're going to be the logistics person. You're going to be the traffic person. And it gives you a basic bullet list of some of the responsibilities that you have. That way you don't have to try to memorize or remember all of these. We have them printed, we have them laminated, so we can hand it to you and you can read through it and be like, okay. Clinical supervisor and clerical supervisor are really close to each other. So just remember, clerical is paperwork, clinical is medication. Greeter is really important. This position is really the first person that the client, as they're coming in, interacts with, and we want to start off right? So this is good customer service. This is being able to handle potentially contentious or difficult situations, especially during the first part of COVID. When we set up our first clinic in this room, we had a line out the door. We were trying to schedule appointments. People had lots of questions. People couldn't get appointments because there was limited numbers of vaccine. And we had some people come in that were quite contentious and demanded that they be let in to get the vaccine. So you kind of have to have a thick skin in this position, especially if it's a high stress situation. The question is, do we have a PIO if we have a lot of people that have questions? And yes, that is huge. So that public messaging, like I said, we really struggled with that at first with COVID. People would hear online like, oh, in other places, people had to wait in line 4, 6, 8 hours before they were able to get in and get their shot. But for us, our longest throughput time was what, 45 minutes at the longest. And I think it was average 30 minutes or less. And that's with a 15-minute wait. Yeah, so we were able to get people in and out really quickly, but because people were concerned or they'd hear things on the news about other locations, they'd show up early. So our PIO would work to get the message out, don't show up until 5 minutes before your appointment time. Because then people were creating their own problem. They were creating lines, although parking and everything else. Yeah. So, and I think that a lot of that credit goes to doing these exercises and doing these trainings, and then that appointment system. And it depends on the scenario. We might have an appointment system or it might just be walk in, depending on what's going on. So that's one of those logistical challenges that we'll have to address at the time. Okay, education, again, making sure people understand the medication, why they're receiving it, how to take it, if there's any special concerns. Some medications that you might need to, especially for kids, it might be a half a pill. It might be that you have to grind it up and put it in pudding, or you need to take it with water, or you need to not eat, or you do need to eat. It all depends on the medication. So there's a lot of education that needs to go in. And usually what we'll also have is some kind of medication information sheet. So during COVID, it was the vaccine information sheet. Clerk, again, making sure that people are sent to the right medication. So usually what we'll do is we'll have one table be a certain medication, another table be a different medication. And this helps streamline the process, right? If you're getting COVID, Pfizer vaccine, you go to this table. If you're getting Moderna, you're going to that table. And that really kind of simplifies the process. But the screener has to catch that. You have to look at those questions and say, okay, this person goes through this algorithm and they need this medication. So that's a very important part of that. Okay, dispensing is pretty straightforward usually. Here's your medication. Okay, here are the different groups of licensed people that are able to dispense medication in the state of Utah. Now, during a declared public health emergency, there may be some exemptions, but these are the individuals that need to be that clinical supervisor or working as that dispenser. Okay, so we have lots of MRC that are medical, we have some that are not, but as you can see, there's lots of different roles in a pod that people can fill. So if you're any one of these, or in a public health emergency, there's also a law that says if your license has expired within the last 10 years, if you're an MRC member, then we can extend that out for 10 years and you can help with. There's the rules about the standing order, because this is a prescription medication, right? Usually you have to go to a doctor, they have to write a prescription, you take it to pharmacy, the pharmacist looks over it, makes sure everything's accurate, and then they dispense. Well, we're kind of skipping all of that, right? This is a prescription for the entire population, and you're coming to us and then we're going to dispense it, right? So who has the ability to do that? And that's why we follow the written protocol at the time of the incident, depending on the disease. So head of household policy. So this is really important. This will be a big part of our public messaging. Is we don't want everybody to show up to a pod. We want one person from that household to show up at the pod and get the medication for everybody in that household. That'll really cut down on the number of people that show up, but they need to have some certain information when they do. So they need to have the names of everybody, their address, birthday and age, their weight if they're under 18. Some medications are weight-based, and then any allergies, because some people can't take certain medications based on their allergies. So this will be a huge messaging part of the pods, and the screeners, the educators, as people come in, this is something that we'll have to help them with. I'll be honest, sometimes I struggle with my own kids' birthdays. When I go and pick up medications for them at the pharmacy or whatever, I'll be like, what is their date? So having it written down beforehand is usually very beneficial as well. But this will cut down on the number of people that come through physically through the pod. Okay, and then observation and exit. Make sure people don't have any questions. Make sure that they take the paperwork that they should take home and leave the paperwork at the pod that they need to leave at the pod. So we need documentation. They need documentation. During COVID, we saw this where some people would take their consent form home with them, and we needed it on our end for data entry. The observation and exit kind of helps answer any of those questions and make sure that they take what they need to take, we keep what we need to keep. So staging area, this is the person that's in charge of that break room area, right? Making sure that everything's set up and being able to be used for the people that are working in the pod. This is also where you check in and check out. So it's really important that when you show up, that you sign in, and when you leave, you sign out. Volunteer time is not free. It counts towards a lot of the FEMA reimbursement. So if there's federal declarations, we can be reimbursed for that time. It really helps us out. And then we also need to track who's there. So all staff that's working in a pod needs to sign in and sign out. Hey, runners, these are going to be the people that are going to go in between. Hey, I need this from the staging area. Hey, we need so-and-so's kid lost their mom. She's out in the parking lot. Can you go get her? Stuff like that. So these are a really important position. Again, security and traffic, making sure that everything flows correctly. We may need some first aid. Again, we're not a treatment site, but sometimes things happen to people when they're in the clinic. We had people that had heart attacks. We had people that fainted. We had people that tripped and fell during COVID. So they weren't sick, but when you get a lot of people in one space, you may need to be able to provide some first aid. But what we're doing is just basic first aid, and then we send them to their medical care provider or to EMS. This is where we start looking at, you get the call. Southwest Utah Public Health Department, we send out a Utah Response Alert. It says, hey, are you available? can you help us out with the pod? What are the next steps? So first of all, it'll be an availability request initially saying, hey, we need people, don't actually go there yet, but we just need to know how many of you are available. And then we can look at your Utah Response account and say, okay, we've got so many nurses, we've got so many people that can help with these different things, and then we can make the assignments. And it might not just be the pod where you're sent. We might need help with inventory stuff at the regional distribution site. You might be in the pod. Another area that we could potentially use you is in the call center. There's going to be a lot of public interest. There's going to be a lot of questions. Maybe there's an appointment scheduling system. We may have you working in a call center answering those phone calls and helping us out there. So it could be any of those scenarios. Okay, you'll get a briefing, you'll get a just-in-time training. Hey, this is what we need you to do. This is the shift time, start time. This is shift end time. If there's anything that you need to do to protect yourself, maybe we're wearing masks, maybe we're wearing gloves, whatever it may be, that'll all be covered in that briefing, just-in-time training, making sure that we're all on the same page. And we set it up, and then you are treated first. So our pod staff are treated first. We want to make sure that they're protected. It also gives us an opportunity to run through the pod and make sure everything flows correctly before we're inundated with people coming in the public. Now during COVID, it was a little bit different. We ended up not vaccinating everybody in the pod first because there were such a limited number of vaccines. At the end of the day, what we did was if there was any left over, then those working in the pod could use some of those last few doses. But the idea is still the same. We want to make sure that our staff and that our workers are able to continue to work. Okay, and then we're going to make adjustments as needed. During COVID, we adjusted our clinic so many times based on changing recommendations from the CDC, based on flow, based on all sorts of things. So it's never always exactly the same. We're always going to be trying to make a few improvements. Then once we're done, we're going to demobilize. That's just basically shutting it down. We're going to collect everything, put everything back away. We might have to do some cleaning up. The senior center, I think we had to replace the floor or resurface the floor because we had thousands of people come through there and it just got beat up. So we want to put everything back to the way it was for, again, we want to return anything to the health department, any equipment, all the paperwork has to come back. We have to document everything. That's a huge part of all this. So all the paperwork needs to come back. We'll either enter it into a system or whatever it may be, and then we'll go forward and then we'll do our hot wash and after action review.